Thyroid cancer is an oncological disease. Look at this picture, shows that thyroid gland and malignant tumor. Ultrasound findings. Look at this. A detail going on. Introduction. Thyroid cancer arises from the thyroid gland located in the neck, which produces hormones that regulate metabolism. Although thyroid cancer is relatively uncommon, its incidence has increased over the years, primarily due to improved detection methods. Definition: thyroid cancer is malignant growth in the thyroid gland, often caused by genetic mutations that lead to uncontrolled cell proliferation. While most thyroid cancers are slow growing and treatable, aggressive forms can spread to other parts of the body and require comprehensive management. Types: 1. Papillary thyroid cancer. Most common type, about 80% of cases, slow growing and often localized. 2. Follicular thyroid cancer, second most common type, more aggressive and can spread to other organs like the lungs and bones. 3. Medullary thyroid cancer arise from parafollicular C cells, often associated with genetic mutations. 4. Anaplastic thyroid cancer, rare and aggressive form, typically occurs in older adults and spreads rapidly. Causes: while the exact cause of thyroid cancer remains unknown, certain factors can increase likelihood of mutation in thyroid cells leading to cancer. These factors may include: 1. Radiation exposure, especially during childhood. 2. Genetic predisposition. 3. Iodine deficiency. Risk factors: 1. Genetic factors, example family history, specific gene mutations. 2. Radiation exposure, therapeutic or environmental. 3. Gender, more common in women. 4. Age, incidence peaks in people age 40 to 60. 5. Iodine deficiency or excess. Complications: 1. Spread to lymph nodes and other organs, lung, bones. 2. Voice changes or hoarseness due to nerve involvement. 3. Difficulty swallowing or breathing if the tumor compresses the esophagus or trachea. 4. Hypothyroidism following thyroid removal. Pathophysiology. The development of thyroid cancer typically begins with genetic mutations in thyroid cells, which leads to abnormal cell proliferation and tumor formation. Mutation in specific cells like BRAF, RAS or RET, PTC have been linked to different types of thyroid cancers. In some cases, familial forms like medullary thyroid cancer are associated with inherited mutations in the RET gene. Pathophysiology of thyroid cancer step-by-step process. 1. Genetic mutation or DNA damage to abnormal cell growth and division. 3. Formation of a thyroid nodule. 4. Angiogenesis, formation of new blood vessels. 5. Inversion of local structures. 6. Metastasis, spread to distant sites. 7. Immune evasion. 8. Hormonal disruption. Each of these steps contributes to the progression and impact of thyroid cancer, from initial mutation through to potential systemic spread depending on the type and aggressiveness of cancer. Signs and symptoms. Lymph in necks, most common initial symptom. 2. Swollen lymph nodes in the neck. 3. Pain in the front of the neck, sometimes radiating to ears. 4. Voice changes or hoarseness. 5. Difficulty swallowing or breathing. Diagnosis. 1. Physical examination, check for lymph or nodules. 2. Image test, ultrasound is commonly used to detect thyroid nodules and guide biopsies. 3. Fine needle aspiration, FNA biopsy, especially for confirmed malignancy. 4. Blood test, assess thyroid hormone levels and check for markers like calcitonin in medullary thyroid cancer. 5. Molecular testing helps identify genetic mutations and assess cancer type and aggressiveness. Nursing diagnosis. 1. Risk for impaired swallowing related to enlarged thyroid or tumor growth. 2. Risk for impaired airway clearance due to tumor compression. 3. Anxiety related to diagnosis and treatment. 4. Risk for infection related to post-operative care. 5. Chronic pain associated with metastasis or surgical recovery. Management. Medical management. 1. Surgery. A. Thyroidectomy, total or partial, is often the primary treatment. B. Lymph node dissection may be necessary if lymph nodes are involved. To radioactive iodine therapy, use post surgery to eliminate residual thyroid cells. 3. Thyroid hormone therapy, suppression TSH to prevent cancer recurrence. 4. External beam radiation therapy for advanced or recurrent cases unresponsive to other treatments. 5. Targeted therapy and chemotherapy for aggressive or metastasis cases using drugs like tyrosine kinase inhibitors. Nursing management. 1. Post-operative care, monitor airway patency, bleeding and electrolyte balance. Educate about post-surgery precautions such as avoiding strenuous activities. To pain management, provide analgesics and assist with non-pharmacological methods such as cold compressions. 3. Nutritional support due to swallowing difficulties. Encourage soft or liquid diets as necessary. 4. Psychosocial support, address anxiety and educate patients on recovery and follow-up. 5. Education on self-care, instruct on in-season care, medication adherence and signs of complications. Treatment. 1. Surgery, primary treatment, ranges from lobectomy to total thyroidectomy. 2. Radioactive iodine therapy, targets residual thyroid tissue post-surgery. 3. Targeted therapy for recurrent metastatic cases includes TKIs like sorafenib. 4. Chemotherapy for aggressive refractory cases, though less effective for external radiation required from non-resistible or recurrent tumors. Psychosocial medicine wants support groups and counseling to address emotional distress and coping mechanisms. To nutritional counseling for patients undergoing treatment to maintain health and energy. 3. Family involvement, educating families on support strategies and patient needs. Prevention 1. Minimizing radiation exposure, avoid unnecessary radiation, especially in childhood. 2. Genetic counseling for those with a family history of medullary thyroid cancer or RET mutations. 3. Regular monitoring. High risk individuals should undergo regular checkups. In conclusion, thyroid cancer is typically treatable, especially when diagnosed early. Advances in diagnosis and treatment have significantly improved survival rates. Supporting patients through surgery, treatment and recovery, ensuring a holistic approach to management that addresses both physical and emotional well-being. Thank you. Have a nice day.